Well, our next guest says there's an urgent need for integrative psychiatry right now during the pandemic. The goal of this type of care is to get to the root of the problem causing us to feel mentally imbalanced, not just to treat the symptoms of that going on. Here to explain is Dr. Aruna Tamala. She is the CEO and medical director of Trinergy Health. Good morning to you, doctor.
Good morning, Tiffany. How are you today?
I'm doing really well. I'm so excited to chat about this. I love psychology and psychiatry, and I think a lot of people have not heard of, I had not heard of integrative psychiatry. What is that?
You know, frankly, even I didn't know what this meant about 6-7 years ago, but I'm so glad that I went down this path. Integrative psychiatry simply means that we have to move away from the framework of mainstream psychiatry, which is really narrowly focused on the chemical imbalance theory and using different kinds of medications for suppressing the symptoms. Because what I learned is that our mind-body system is an interconnected organism. Everything within the body. The brain is talking to the gut is sending information back to the brain, the immune system is communicating with everything else, the hormones are communicating with everything else. And then when someone comes up with symptoms of depression or say anxiety, we think of it as just a brain disorder. The brain is not making the chemicals as it should, and that's why we see these symptoms. But in reality, the brain and the mind is merely a manifestation of the imbalance, which could be completely far away from the brain. And so in the last 4 to 5 years that I've practiced integrative medicine in its purity, what I've learned is that you really need to get to the root of the problem to help people find lasting health and wellness. And that is what we do here at Trinergy Health.
I'm obsessed with it. I think it's genius because in the last few years, we've heard so much as you're talking about the gut connection and that maybe even some of these issues like depression and anxiety are even starting in our gut that can be imbalanced. So the fact that you're working with the whole body is, I think, truly on the forefront of mental health wellness. So what kind of, I guess, conditions are you applying these treatments to? Where are you seeing it really work?
Everywhere. And I mean literally everywhere, from depression to anxiety to neuropsychiatric syndromes to autism. I have adults and children with autism. And of course, you know, when I say autism, I'm not peddling a cure for autism. It's a permanent damage to the brain. But many of the psychiatric manifestations of behavioral disturbance, severe anxiety, stereotypies, all of this, which is really a manifestation of additional inflammation by a damaged brain, they can all be helped. And that itself can give rise to so much of improvement in quality of life, not only for the patient, but their family members. And it also reduces the burden of having to care, the long-term care for somebody like this. So you can apply this for any condition. In fact, I very passionately feel that not only mental illness conditions, but also every physical condition, we need to look at it from a whole person perspective. But what has happened, unfortunately, in modern medicine is that every specialist is in their own silos and they don't talk to each other as they should be. But our body's not operating like that. I mean, just to give you an example, 5 years ago, if someone came to me and said, oh, I've also been diagnosed with Hashimoto's thyroiditis, I would say, oh, go to your endocrinologist. You're depressed, I'm going to address that. Or if somebody had migraines, go to your neurologist. I don't know what to do about it, but I can help you with anxiety and focus problems maybe. But today, I take all of those problems, and that is what, and we just institute a whole wellness program for the whole body. So not only are they getting better from the depression and anxiety, but all these other conditions that I mentioned, like Hashimoto's, acid reflux, migraine headaches, IBS, people are recovering from all of these in my practice. So, and that is what really excites me. Yes, absolutely. And it can be done. It doesn't take long for people to experience wellness again.
I think a lot of people are going to feel excited about that. I love how you mentioned the silos and trying to bring them all together. You know, that's something that's so important. Talk about Ayurveda and how Ayurveda is really used to help patients right now.
So one of the things, when I started my journey down the path of getting more education and training in integrative medicine, the two disciplines that really spoke to me was functional medicine and Ayurveda. They're actually very closely interlinked. Ayurveda is India's medical science tradition. It's been around for 5,000 years. It's actually the most continuously practiced medical tradition in the world. And Ayurveda is all about balance. It is about balance within ourselves, it is balance within our communities and with our ecosystem and nature. And in incorporating these values from Ayurveda, and the other thing that Ayurveda is big about is focusing on lifestyle, routines, as well as using food as medicine, which is why we invested in our organic herb garden. This is actually a community garden. And as you can see, it's flourishing, and this is for the use of anyone that comes here, our clients, our staff, and I definitely harvest my lettuce from here. And really, this is the philosophy that I'm trying to teach my clients, my patients, and the larger community through them. You can find a lot of healing through food as medicine. So that's I would say that is the biggest contribution. Yeah.
Absolutely. In the wake of COVID-19, I think so many people are feeling mental health issues even stronger. What are you doing just so everybody knows that they can come in to see you to kind of mitigate the risk dealing with the pandemic?
Yes, I would say that we, with our holistic approach, we are uniquely positioned to really help people before they get COVID and to make sure that we reduce their risk of getting COVID. And if that happens, again, we are in a unique position to help them. And the reason why I say that is because as part of this holistic approach, we are always managing the immune system, balancing it out. So with COVID, it is a virus, but again, we know that some people really have a lot of severe effects of it, but then there are some people who are okay with even contracting the virus. And the big difference, if you ask me, between these two sets of groups is how their immune system is coping with the attack from this virus, and that is what we can help with. And as far as COVID itself is concerned, it not only because of the isolation and all of the impositions on our daily life, we are seeing a lot of anxiety going up. In fact, the social distancing and the emphasis on lockdown procedures, very, very useful. But I'm already seeing reports that that is translating into agoraphobia, which is a fear of leaving your home. So we really need to be mindful about all of these things and find balance between safety as well as the essentials of our daily life. Not only that, a third really important, but here's the other thing. COVID infections itself can cause a lot of neuropsychiatric manifestations, from psychosis to delirium to, we've heard loss of smell and taste, but we're also seeing a lot of psychiatric syndromes as well happening. So all of that,
Doctor,
again,
we
the
ran out of
secondary
time,
manifestations.
so I hate to cut you off real quick, but I want to make sure that I can give everybody the opportunity to have their 60-minute consultation with you. So I'm going to give all that information. Thank you so much for joining us.
Yes, thank you. My pleasure.
Appreciate it. You can contact Dr. Aruna Tamala. Here's how you can do that. To see her videos, read her blogs, and the patient testimonials, here's where they're all at. It's at trinityhealth.com. You can get a 60-minute Ayurvedic consultation with 10% off just by mentioning the morning blend. Call at 262-955-6600 to take advantage of that.